I had not seen the recording start yet. That's why I have not started.
Good morning, Director Reese. The recording has started.
Okay, thank you. Good morning, everyone. Good afternoon. This is Andy Reese, Director of Department on Disability Services. Let me first share our data. There we go. So our numbers do continue to be certainly higher than they have been in the past, hopefully coming down some in January. We have had 54 people test positive for COVID in January, bringing the total up to 604. There have actually, if you add up the different diagnoses per month, you come up with a total of 621. But that includes 17 people who have tested positive twice. 7 were in December. 8 people were diagnosed a second time in January, and there were 2 who had previously tested positive twice. Since December 1st, of 2021, we've had 169 new infections, and of these, 46 were fully vaccinated. And that included 34 people with a booster and 12 who had received their initial vaccines too soon to be eligible for a booster. And then we had 23 people who had had no vaccine at all. So by placement type, oops, just trying to move something out of my way. There we go. By placement type, we've had 1 person in a correctional facility, 14 people now in host homes, 126 people in intermediate care facilities, 1 person in a mental health facility, 113 people in natural homes, 2 people in a nursing home, 6 people in out-of-state placements, 50 people in residential habilitation placements, and 291 people in supported living. So in intermediate care facilities, the 126 people represent about 42% of people in ICFs who have contracted COVID. Of those 126, 28 have died, but only 13 of those have been confirmed COVID deaths, representing a little more than 10% of people in intermediate care facilities who have had a confirmed COVID death, who had COVID and had a confirmed COVID death. In natural homes, the 113 people represent about 12% of people in natural homes. There have been 6 people who have died, but only 5 of these are confirmed COVID deaths. So those 5 people represent about 4% of people who are in natural homes who contracted COVID and had a confirmed COVID death. In residential habilitation, almost 46% of people have contracted COVID. Of these, we've had 3 deaths, but only 2 that were confirmed as COVID deaths. So of the people in residential habilitation who've contracted COVID, 4% have had confirmed COVID deaths. In supported living, the 291 people who contracted COVID represent about 30% of people in supported living. We've had 27 deaths amongst people in supported living who had COVID, but only 15 of those were confirmed COVID deaths, representing just a little over 5% of people in supported living who contracted COVID and had a confirmed COVID death. So overall in DDA, 604 people who've contracted COVID represent about 25% of people supported by DDA who have contracted COVID. We have had 68 deaths, but only 37 of these are confirmed as COVID, representing about 6% of people supported by DDA who've contracted COVID who have had a confirmed COVID death. So by placement type in the month of January, the primary placement types in intermediate care facilities, we've had 9 people test positive for COVID. In residential habilitation, we've had 8 people test positive for COVID. In supported living, 27 people. And in natural homes, 9 people. Fortunately, we have had since last week no additional people who have required inpatient treatment for COVID, and there are currently no people in the hospital with receiving COVID treatment. As I indicated, of the people who have contracted COVID, we have had 68 deaths. However, this includes 16 that have been confirmed as not COVID related and 15 for which we are awaiting confirmation from OCME regarding the final cause of death. And so the confirmed COVID deaths, there have been 37. The last confirmed COVID death we've had was in March of 2021. And among provider staff, there have been 992 provider staff who've tested positive for COVID. We added 18 in the past week. That number does seem to be coming down. The prior week, we had added 59. The week before that, it was 81. So at least the weekly count has come down some. 60 of the people who've been reported were reported by more than one provider agency. And we have had 10 provider staff who have died from COVID. In terms of vaccination status, we have seen some movement here. People supported by DDA, we're at 85% vaccination rate. In host homes, we're at 95%. In ICFs, we are now at 100%. In natural homes, we have finally seen some movement. It's up to 73%. It was kind of stuck at 65% for quite a long time, so that movement was really nice to see. Residential habilitation is at 98%, supported living at 92%. Our provider staff is at 95%, and DDS staff is at 94%. So that was all of the data that we had for the week. As always, we have our colleagues from DC Health with us to answer any of the health-related questions. And as a reminder, if you have a question, you can type it. Make sure you direct it to everyone in the chat, and we will do our best to respond. Thanks. Is the list of day service options posted on the DDS website? Shasta, do you know the answer to that question? I
Yes,
know.
I will add the link to the chat.
Thank you. If you have elected to mandate the vaccine, is there a way that agency data does not need to be submitted weekly as it would be the same? I think it's submitted bi-weekly, isn't it, Shasta? And I don't know, I assume,
Agency data is submitted bi-weekly.
right. And so it is mandated. I don't know if the you is you or like you, the provider, has elected to mandate it, or you, the government, has elected to mandate it. DC Health has, in fact, mandated it. Um, so yes, it does still need to be provided, but if it's mandated, then it seems pretty easy to respond because it would be 100%. That doesn't seem like a heavy lift to me. I'm not clear, I guess. Once everyone's been vaccinated, it seems like you're submitting the same data every 2 weeks. So it's just a matter of hitting send on the same report, right? But to be clear for people, there is the mandate in place that applies to all direct care staff are required to be vaccinated unless they have an approved waiver from DC Health for either a medical exemption or a sincerely held religious belief exemption. Um, as we've said before, those exemption requests are being handled as quickly as they can, but that process is moving slowly. But in the interim, people who have requested an exemption can continue to work as long as the exemption has not been denied. If the exemption is denied, they are then required to get vaccinated in order to continue to provide supports to people um, supported by DDA. And even agencies I know of an agency that's had a mandate for more than a year, but even that agency had to have exceptions for people, in the event of a um, medical reason the person could not get vaccinated or some religious belief that prevented them from um, being vaccinated. And so, they would report on the 99% of their staff that had been vaccinated. Well, it seems like a pretty quiet day here, which is not a problem for me at all. um, Does DDA have a policy or transmittal to address how providers should respond to DDS staff requests for documents when conducting virtual reviews? We're receiving issues from service coordinators for not sending them requested documents when the documents are uploaded at MCIS before the monitoring. Can Winslow respond to that? I don't.
Sure. So, for those who are regularly participating in this call, we kind of had this mentioned once before, so thank you for bringing this up. So, the issue is that the provider has uploaded the documents. Service coordinator in doing a virtual review is requesting the documents, and at that point, I would recommend that the person being interviewed by the service coordinator is then sharing with the service coordinator that the document already is uploaded and exists, and or sends an email to that service coordinator that the document is already uploaded. Because what it sounds like is just a sort of a communication imbalance. Because if the document's already there, I don't see a reason why the service coordinator would need it electronically if in fact it is already uploaded. So in cases like that, it's a simple communication, I believe, and if that doesn't work, I can be reached at 202-730-1618, and I'll be happy to work out any individual cases that may come up. Thanks.
So this next question, how does the agency know if a DSP's request for exemption is denied? It's something of an honor system, sort of, in that the DSP can provide to you, or whichever staff has sought an exemption, can provide to you evidence that they submitted the request for the exemption. And if the exemption is granted, they can provide for you evidence that it was granted. If it's denied or granted, that information does only go to the DSP. It doesn't go to their employer. And so, if they were denied and didn't tell you, and for example, the mayor's order doesn't require it, but if you have a policy, I hope you would, of requiring someone to test if they're not being vaccinated, and they continue testing and saying, I still haven't heard, at some point, all of these will be caught up. And at the point when other people start submitting their denials or approvals, and when DC Health is reporting to us that they have actually worked through this whole backlog, you will then know that the person does not have an approval, and you can proceed accordingly. But the provider is not separately notified, that unfortunately. So I'm not clear what meeting this person is trying to attend. They got a letter of intent approval last year, supposed to get vendor information session invite. This is not a vendor information session. If you can put your contact info, if you can send your contact information to the panelists rather than sharing it with everyone, we can make sure that someone in operations follows up with you regarding DDS providers. With staff testing after exposure, are we required to follow guidance for conventional or contingency plans which indicate testing on day 1, 2, 3, 5, and 7 after those not boosted, or we just test exposed staff immediately and 5 to 7 days thereafter? Can I punt that to Nelson?
Sure. I'm not sure that I'm 100% sure what's asking, but when you're talking about whether or not to follow conventional or contingency capacity, if you're an agency that is not regulated or licensed by DC Health, so I guess would be regulated by DDS, I would encourage you to have discussions about moving outside of conventional capacity with DDS or whatever agency regulates your site or your setting. Specifically with work restrictions for healthcare providers who've not received all COVID-19 vaccine and booster doses as recommended by the CDC. So basically that means you're up to date with vaccines. You're not up to date with vaccines. You might have had a primary series, but you haven't been boosted and the time period has passed where you're able to get boosted, but you haven't. Those individuals should be excluded from work for 10 days after the last exposure, or can be excluded from work for 7 days with a negative COVID test. So as far, some of what you're asking is part of contingency capacity. And if you're to the point where your staffing levels are to, a level where you're unable to or having difficulty providing proper levels of care, then I would encourage you to have a conversation, a collaborative conversation with the agency that manages your setting before you move out of conventional capacity.
And for agencies that are asking this question, that are not asking regarding an ICF or a ResHab, which would be regulated by DC Health, then you would need to reach out to your quality resource specialist to discuss this.
So on that line, just also for clarification, if you are a facility, as Director Reese has said, that is regulated and licensed by DC Health, there is a requirement to obtain permission from DC Health to move outside of conventional capacity to receive approval. And so if you are in that setting that meets that requirements, please reach out to coronavirus.hai@dc.gov, which is in the guidance. I believe it's on page 2. And we can have that discussion so that we can learn more about why, what's going on in your setting and discuss what the best way is to move forward.
So if people don't have other questions, there's really no need for us to hang out here together. I imagine that everyone is feeling a bit exhausted at this point in time. I'm always nervous to say anything about the numbers because I'm a little superstitious. We do seem to be on the other side of a peak in that, even the staff numbers look like they're edging back down, which looks encouraging, as well as, even the people we support, the numbers are lower, which sounds good. Certainly everyone needs to continue paying attention to all of what we needed to be paying attention to all along, which is, vaccination, boosters. I will say, as I said earlier, the people we support, the vaccination rates in natural homes looks better. I know that our quality folks have been working with the providers to make sure that the data that we have is up to date, as well as making sure that folks are vaccinated and boosted as appropriate. And so it is good to see those numbers improve while also continuing to pay attention to, the masking recommendations, distance, continuing to wash hands, etc. The turnaround time for approval of a contingency plan. Do you happen to know that, Nelson, for the folks that requested from DC Health?
So, well, I guess I can only speak for DC Health, but the response is very quick. If you reach out, that doesn't mean the approval is very quick. There's going to need to be some further information that we will request from you, including some of the measures you've already taken and some of your staffing ratios and things like that. But that discussion happens very quickly, so I'm not going to put a specific time on it. But it is fairly quickly turnaround time, as we do understand that if you're reaching out, there's usually an urgency. That being said, I will say that there are some requests that don't meet the necessary. They haven't done all the steps necessary to be able to move into that outside conventional capacity. So please make sure that you've really done everything and kind of thought outside the box as far as staffing and things like that before you reach out, because all of that will come out when we start to have discussions.
Someone just asked that we remind residential providers if a person you support has been diagnosed with COVID. Apparently MCIS doesn't always send a tickler as soon as the incident is entered to the day provider. So make sure that the day program is aware that the person tested positive so that any follow-up that's needed there can be done. And yeah, we have been getting so many reports that it's not surprising that some of those might not go out to everyone, but it is essential that, that everyone be notified so that any necessary additional testing of people, so that people are aware they've had an exposure and, can, if necessary, quarantine and get tested as appropriate. How many medical or religious exemptions were submitted and how many remain undecided? We don't have we don't know the answer for that for DDA providers. We have the overall number for HRLA, which I didn't get an updated number. I just have the numbers that I had provided previously, which are 2 weeks old at this point, but I can find them and read them again if people are interested. And we can ask them, I guess, for an update to this update. It seems to be somewhat slow going. Religious exemption, it appears for HRLA, There were 1,956 submitted, 11 denied, and 1,945 still pending. For medical exemptions, there are 1,360 still pending. There have been 168 denied and 31 have been granted. And this is data as of 2 weeks ago. So we can reach out to DC Health to ask for current data and see if we can report back on the current data next week. But as I said, and they have acknowledged, and we've reported here that that is moving slowly, but that they are moving it along as fast as they can. So it says having exemption requesters self-report an adverse finding, which will result in their termination, is not really a process, except to say that once the number pending is 0, the person either needs to produce a waiver or evidence of a vaccine. I don't know, and we can ask when we ask for the updated data, whether DC Health can break down the information in a way that we would be able to say, these are the people who are supporting folks at DDA. Because it's entirely possible that people that work for you are also licensed I mean, I just don't know how they would break it down. And any of your direct care staff are required to be vaccinated. So it isn't just direct support professionals. We will ask DC Health the question and see what the response is. But as I said, as they get through all of these, and they will get through them all, when there are no longer any pending, or when everyone else on your staff has shown you that they had their response, then your holdouts either have to have a response or a vaccination.
Director Reese, I did hear briefly from Herla that the majority of the medical exemptions that have not yet been approved have requested additional documentation from the people applying. And so the delay, at least on that side, is not necessarily DC Health, but there's, seems to be a significant delay in people providing adequate or appropriate documentation that's being requested. So that's also making things take longer.
Thank you. So there's a comment, it would seem fruitful to have a system that providers could log into, similar to where we check to see if a person has a license with HRLA. We'll pass that comment along. So I'll perhaps Shasta can respond to, based on the email yesterday from quality resource specialists, people who have an upcoming COVID vaccine appointment, the system is still counting them as an issue against the provider to face sanctions. Provider cannot upload anything before the vaccination happens.
Yeah, so the emails that went out that had the people who have upcoming vaccines, most of those emails had NA if the person had a vaccine. The first dose that was issued in January, so those are not counted. But if there are additional people who vaccine their second dose is beyond that time frame, then yes, they are counted.
And it's an issue till they get the vaccine.
Yes.
Right. Because we have a mix in terms of tracking vaccinations, I will say, because, you know, as with this most recent variant and surge in infections, one of the things that we have looked at for each person is there evidence in MCIS or in the access we have to CRISP, to the medical data, whether the person has received, is fully vaccinated, whether they're, you know, they have a recent, that whether they've recently gotten two doses of the mRNA or very recently gotten the Johnson & Johnson, or if they were due for a booster, did they get the booster? And we are finding that there are a lot of folks where MCIS has not been updated. And so this is where they're reaching out, is to make sure that we have current, accurate information, because we do need to make sure that everyone is as protected as they can be from serious outcomes from this infection.
Yes, and I would also like to add that there were two transmittals that were sent out in reference to uploading the booster vaccine information. So once the QRS are sure that the information for vaccine doses 1 and 2 have been uploaded and in the system, providers, please be on the lookout for the next email that we will be sending out in reference to the people who are eligible for a booster and the information has not been uploaded in MCIS. And by information, we have it programmed so that if the person refuses the booster, that's also considered documentation. But if they have had the booster shot, then the expectation is that that information is also uploaded into the new database.
So for individual issues, you should escalate them if your QRS isn't is if their response is inadequate, then please escalate that to their supervisor. Are all staff required to get the booster vaccine as well? There is no requirement at this time. The requirement in the DC regulations regarding healthcare professionals that are working with the people supported by DDA is that they be fully vaccinated, which is just defined as the first vaccinations at this time. That was by regulation, so the change might require, if it were to change, might require a regulatory change, I think. So is it a requirement? No. As Nelson had mentioned before, if you look at some of your staffing issues, you know, it can have an impact on the changes you're able to make with staffing. whether the people are actually fully vaccinated, including with a booster. And you, of course, as an agency, can make your own decision in the same way that the district government has made its own decision that all of its staff should become vaccinated and get a booster when it's due. But that isn't yet in the required guidance for our providers. But all, as I've said before, all the mayor's orders that have gone out have said that, this is a minimum requirement and nothing in it prevents an agency from imposing a higher requirement, except, of course, the Constitution or other laws like the ADA. So, you can't say that you can't refuse to consider someone's sincerely held religious belief or a medical necessity that prevents them from being able to get the vaccine, to make a reasonable accommodation for that. But you can impose a mandate. This says the new MCIS has only the first and second dose sections. Where will the booster be recorded? It actually does have the booster. The way that it works, though, is if the person is not yet eligible for a booster, you won't see anything. If the person is eligible for the booster, just below where you've uploaded the data for the first vaccine or the first and second, if it's Pfizer or Moderna, the booster tab will be highlighted. You click on that and then it pulls up the other screen so that you can upload the booster information. So if you're not seeing booster information generally, that means that the person is not yet due for a booster. But I do know I've been in the new system looking at booster information, so it is there.
I will post a transmittal in the chat, which provides the screenshots of how to upload the booster information.
But even in my presentation today, if you'll recall, of the people we have a number of people who've received their initial vaccines and it's too soon for them to have a booster. So for those folks, you won't see anything in MCIS regarding a booster. So if there's someone asking, how do you document if someone isn't yet due for a booster? You don't need to document anything because you actually will not see anything until the person is due for a booster. And Beam stays on top of updating MCIS to add that link consistent with CDC guidelines regarding the recommendation of when boosters should be done. So, the now 5 months for Pfizer or Moderna and 2 months for Johnson & Johnson. It says the person so if you have specific individual questions about uploading information, then contact your QRS and they'll work with you either on helping you through the process or having Beam address any technical issues that MCIS is having. Someone is asking if the new MCIS background colors and letters could be changed. Light on light colors are very difficult to see, and light good for anyone eyesight. I actually like the new colors, so I'm like, one of the issues that we do always consider is accessibility. Yeah, I mean, we'll communicate your concerns to Beam. I kind of thought the new MCIS was more attractive.
Unfortunately, the transmittal hasn't been uploaded to our DDS website yet, so I can't forward it as a link. But if someone needs a copy of the transmittal, you can either email me and I'll put my email in the chat, or I'll just have Jocelyn reissue the booster email to the community again.
Someone agreed the new MCIS is far more inviting and user friendly. I will communicate that to Beam as well. Thank you. So for people who are on their phones that need to get in touch with Shasta regarding the transmittal, it is Shasta, SHASTA .brown@dc.gov. Okay, it seems that we don't have any other questions today. With that, I guess we can draw to a close, and everyone have a very nice weekend, and we will be talking to you again next Friday. Thank you.